So to go in with the microneedling, with the radiofrequency, kind of give her that overall glow.
Yeah, so it's a way to stimulate your body's own production, right?
Yes.
Yeah, that's very cool.
You can do your tear troughs, you can do your cheeks, your lips, your hands. Everyone wants to make their hands look younger.
Last time I saw you, you did some laser hair removal on me. Does it hurt? I'm sure the audience wants to know, does it hurt?
It does not hurt.
Hi, everyone. My name is Dr. Esther Peterson, and I'm here with another episode of What the Floss. And I'm super excited to introduce you today to a good friend of mine. This is Allie. She's a nurse. She's a beauty expert, and I'm excited to visit with her today. Hi, Allie.
Hi, Dr. Peterson. Thanks for having me today.
I'm so happy you're here. Allie, tell us a little bit about your background. What are you?
I'm a registered nurse. I work at Hideaway. I love it. Aesthetics is an evolving area. So really looking forward to digging into that more. Our devices that we have are amazing.
Yeah, and you've gotten to play around with quite a few of the devices already.
Yes.
So you were just telling me just yesterday you had a client come in who wants to do the Transform Your Skin kind of package where she gets to choose from all the different machineries and all the modalities that it has. What did you start with yesterday?
So yesterday, we had a consultation. We went over her needs, her wants, her desires. And from that, we kind of just, broke it down. What treatments are best for her? What is she looking to achieve? And how do we get there? Overall, we picked Transform Your Skin. So that one's really great in the sense of you can do any of the treatment or any of the devices. She's really interested in microneedling. So our Scarlet SRF is, something she's really looking forward to doing.
So you're actually my aesthetic nurse, right? And you did that same Scarlet radiofrequency microneedling on me, but we didn't do my face. We did my back area, right?
Yes.
So I wanted to look really nice before I took a trip out of the country and had to wear tank tops and swimsuits and all that stuff. I wanted my back to look nice and refreshed, get rid of that dead winter stuff.
Yes.
So thank you for that. That was amazing. So I'm sure she's going to love seeing that on her face too. It's going to be amazing results. So yeah.
This patient actually, she has had a history of acne. So she had some scarring, some areas that just really needed, she needed that skin resurfacing. So to go in with the microneedling, with the radiofrequency, kind of give her that overall, glow, that collagen and elastin, get that to reproduce and stuff.
Yeah, so it's a way to stimulate your body's own production, right?
Yes.
Yeah, that's very cool.
Yeah.
So I got to tell you, all the other nurses at the med spa call you the lip filler queen, and not just lip filler, but the filler queen. So you really understand what it takes to make a face look youthful again, to restore that lost volume as we age, or just even when you're young in your 20s like you, how to just enhance what you already have. So you have been, it's my understanding, you've been a patient first, because you used to do lip fillers and get fillers yourself. And now you're performing those kind of same lip fillers. So I can see how your expertise would kick in there. So tell me a little bit about why you wanted to do lip fillers in the first place in your 20s.
So for me, I guess I feel like it's a trend. It was a trend thing when I kind of started to get it done, just to add a little bit of volume on my top lip. My bottom lip has always had more of that volume. My top lip, not so much. And it tends to hide when I smile. So I wanted there to be more of it to be more equal. So I'm a big fan of the golden proportions, right? Yes.
So I'm a dentist and I study faces all day long. And so upper lips are supposed to be at about a 1 ratio and bottom lips are supposed to be at 1.6. So I understand that.
Yeah.
And how many years did you do upper lip filler?
So I have done it, I want to say probably over a period of 5 years or so.
Yeah.
In the meantime, I've only had them, I think, done about 3 times with the synthetic filler.
Okay.
My last time doing it, I actually did it with the RPR.
Oh, okay. Nice. With
PRP,
the PRP. Yeah.
PRP.
Yeah, with the PRP. So back to dentistry a little bit. So I've been using PRF, which is a very similar version. So platelet-rich fibrin. But in the med spa, we use platelet-rich plasma, so PRP.
Yes.
So when we use PRF in the dental office, anytime I take a tooth out, I do a blood blood draw, spin their blood down in the centrifuge, and make their body's own Band-Aid to put over that socket so they don't get dry socket. The idea is to stimulate that collagen, elastin, fibrin, white blood cells, all the good stuff that your body has to promote healing in that area. And like I said, it prevents dry socket. So when I saw what you were doing in the med spa with the PRP, I was blown away. I was like, yes, this is perfect. So what I saw is that on that day of training, you had spun down, you drew some blood from the patient's arm, or you had blood drawn because you were actually the patient.
I was the
too,
patient,
yes.
yeah.
So you had blood drawn. We spun it down in the centrifuge, and then we drew out some PRP in that. And what I noticed is you didn't just have the one syringe of filler, like when you go in to get your lip stem with synthetics, you get one syringe. But with this, you had multiple. You had a whole bunch laying on the tray.
Yes.
Yeah.
Which was amazing because you have your blood drawn once, we spin it down, we heat it, then we cool it, and then we pull it, and we kind of mix it back and forth, and it makes almost like a liquid gold. It also gives you that filler. So you can use that for volume as well as collagen, elastin, helps give your skin more of a glow, and you can use it anywhere.
Oh, is that right? So I can come in and see you because I have some hollowing out under my eyes right here. So I want to get a little tear trough augmentation done. So is it safe enough to put here? Okay,
Yes,
I've heard with the traditional fillers, it's very technique sensitive because there's a lot of vasculature. I don't want to get a vascular occlusion or anything there, any kind of damage there. So tell me, why would the PRP be a safe option for me?
So the PRP, for one, it's your own body. Your own body, it's not a synthetic. When we draw it, we spin it down, and then there's no risk of vascular occlusions. So that is a big perk for it.
So Allie, with this PRP stuff, is there anybody that should be careful about being a candidate? Is there anybody that doesn't qualify to use it?
So unlike synthetic fillers, we have to be really careful about, do you have health conditions such as, are you on blood thinners? Are you, do you have an autoimmune disease? Stuff of that sort. Typically contraindicated on those patients. Really great thing about the Solenis, if you have autoimmune, you're more likely to be able to get this as an alternative.
That you couldn't do with traditional fillers.
Correct.
Because it's synthetic and your body would reject it. Makes total sense.
Yes. Although with blood thinners, we have to be careful. We're sticking a needle in. You're at an increased risk of bleeding. So that would be one thing that we would have to sit down and talk about.
Okay, fantastic. And are there any areas that you cannot use this? Because you mentioned that we can get multiple syringes from just one blood draw. So when we use synthetic filler, we get one syringe of it. Here we get 4 or 5 syringes of it. So where else can I put it?
You can do your tear troughs, you can do your cheeks, your lips, your hands. Hands are such a huge thing nowadays. Everyone wants to make their hands look younger.
Yeah, it's so true.
So we see filler being used all the time in the hands.
Okay, very nice. Yeah. I'm thinking of the cellulite areas and does it work there?
Just in perfect time for summer. You can get your BBL with it.
I love it. And it stimulates your body's own natural production of it, right? Which I think is the coolest part. So there's no risk to it, or very, very low risk. It stimulates your body to start producing its own youthful ingredients again. So I don't see a downside to it.
I know.
So I can't wait to start with you. One other thing, last time I saw you, you did some laser hair removal on me, which thank you for getting rid of the goatee, the Indian girl goatee. Come on, brown girls. We all know. We all have them, right? So, but Allie got rid of mine, and it's just been one session. I haven't had to come back yet. So I know I need to come back and see you for a little touch-up, but realistically, like one treatment, and it was great for me. It's really thinned it all out, and it's all gone. So I love that. So thank you very much for that.
Yeah, of course.
Tell me, what is that laser hair removal like? Where can I use it? It's coming up on swimsuit season, like you mentioned, for the BBL and all that. So tell me, what can I do with the laser hair removal? What else can I do?
So laser, we actually offer a really amazing package. You can do a monthly membership of this package, and it is 45 minutes laser away. You can get all your areas done for a monthly price.
And 45 minutes, you can do
45 minutes, you can do your whole body.
This took under 5 minutes. It took no time at all.
Yeah, it takes no time. It's super quick. I remember you had asked me, am I going to see against the skin that the hair follicle is gone.
Right.
Which we have you shave prior, or we'll shave you.
Right.
And I told you it actually is going to target the base of that hair follicle. So that light is going to attract all the way down to that follicle and destroy it. Yes, hormonal changes can cause hair regrowth and stuff. That is just a normal part of, our natural bodies.
Yeah. So can I do the bikini area?
Oh, you sure can.
Okay. All right.
And it's perfect time to do it because we do have summer coming up and we don't want you to have sun exposure. So
right.
we can get you in, get a couple months in, get you good for summer.
How long in between treatments do you have to go for the laser hair removal?
So we recommend 4 weeks in between treatments. You can stretch it a little bit past that, but I would recommend 4 weeks, especially if you're wanting to do areas, that are going to be exposed to sunlight since we are approaching the summer.
Okay. And I know the answer to the question because I've already had it done in a pretty sensitive area, but does it hurt? I'm sure the audience wants to know, does it hurt?
It does not hurt. This is a very widely asked question. Does it hurt? The old lasers hurt. So people say, I've never had a laser used on me prior. That's not this one. But they always say the snapping of the rubber bands.
Yes.
Personally, I've not experienced that with ours. It actually gets really cool. There's a cooling tip on it. And it's very comfortable. So I actually had someone fall asleep during their treatment on Saturday.
Oh my gosh, that makes me jealous.
So I do not think it hurts.
That's awesome. I have to second that motion. So I had some, again, really sensitive areas. We did upper lip as well, which can be very tender, and it did not hurt. And I had done laser hair removal 10 years ago. And then I'm back in for my touch-ups and everything. But 10 years ago, it really did feel like that snapping of the rubber band, and it did hurt. And we had to put aloe gel afterwards and hold ice packs. And this was not difficult at all. There was occasionally we'd hit like an area that was right on a jawbone or the thinner skin as I'm getting older. And that would feel like a little bit of a snap, but that was it. So I have to agree. It did not hurt a bit. So I can imagine if I did my legs and bikini area, it would be really comfortable. So
good.
Yeah. I'm excited. So sign me up for 2 things, Allie. We're going to do the filler, the PRP. We're going to do laser hair removal.
We're just going to have a spa day.
We're going to have a spa day.
Yes.
That's perfect.
Get it all done before summer.
I love it. So Allie, I found this video from the Academy of Facial Aesthetics where you and I both trained. So top-notch aesthetic place. I found this video online that asked a little quiz question about what's happening here. It was an adverse reaction to a lip filler. So let's take a look at this and you tell me what your take is on this.
Welcome to the 8 Feet Game Show. Is this a bruise or is this a vascular occlusion, otherwise known as a VO? Take a look at the capillary refill. Take a look carefully and tell us what you would do in this situation. What would you recommend? Filler and bruised lips just went in. What do you think? Go ahead and put it in the comments and like and follow for more.
Okay, so Dr. Malmacher in that video called it a VO. What does VO even stand for?
That is most definitely a vascular occlusion. So
what happened there?
So when you see that when he was pressing on that lip was not coming back. That pink color, that redness was not returning. That means the capillary refill was not there. So that filler, when it was injected, it hit probably an artery.
Okay. So it blocked up the artery, the blood vessels in there.
Correct.
Okay,
Which, if that does not get reversed immediately, that can cause long-term problems.
Okay. So in addition to just normal bruising that you would expect with the filler, what would happen? What would be the long-term effects of that?
So first off, we would want to go in with a reversal right away. That would be in another injection. We would inject it at that spot to dissolve that filler. Once we inject it, we'll massage it in. It should break that filler up and then help take pressure off that artery so that blood flow can return.
Okay, excellent. And do you keep those kind of supplies on hand, or do you expect this to happen? Or is it kind of like a few and far between? Is this a true risk?
It's a true risk. You should always inject, with it near you.
Okay.
You never know when it's going to happen. That's another thing. You should go to an injector that has had the training, knows, the anatomy and stuff. Yes, no matter who you go to, there's always this risk. But you want someone that really understands the anatomy. And then, in the situations that this does happen, they know what to do and how to respond quickly.
I got to tell you, I love it that you're not just somebody who took one weekend course and then jumps in and tries to do lip filler. Like, you are a trained RN, you're a registered nurse. You know body anatomy, facial anatomy, lip anatomy. You know it inside and out.
Yeah.
You've been trained on it specifically. And then you started introducing lip filler. So tell me, when you do the PRP version of the lip filler, which is the all natural version, do you run into these same problems? Is this still a risk?
The risk of a vascular occlusion, there are no risks with the PRP.
Wow.
So that is pretty amazing.
That sounds like a game changer.
Yes.
So for anybody that's like afraid that something like this might happen and that it might damage their lips long term, sounds like PRP is a really great option.
Yeah. And also with PRP, with synthetic filler, I've ran into this myself. You have filler for a while, synthetic. For instance, I've always had my lips done. Over time, I'm a talker. So my filler will migrate up and kind of go above my top lip and give me kind of a full lip on top, not where it should be in my lip. It kind of creates like they say a bull lip, kind of makes you puffy up here.
Yeah.
Anyhow, the PRP is more natural. It should not migrate like that.
How long ago did you have your PRP put in?
I had mine done about a month ago.
Okay. And did you run into any issues with that? How was it afterwards? Like immediately after
It was
now,
good.
a month later?
It was good. It was a really awesome process. I loved having, my own plasma, injected back into my lips. It was more of a holistic approach, a natural approach. And I still got that volume effect, just like I would with the synthetic filler.
Oh my gosh, I love that. I love that. In a movement to have wellness first, I think that's fantastic. No added chemicals. You're not putting anything artificial in your body. You're literally using what God has given your body. I think that's amazing. Yeah. Well, thank you for joining us on another episode of What the Floss. And thank you, Allie, very much. I so appreciate it. Come see Allie at Hideaway Medical Spa. She is the best. Come get the safest filler ever.
Floss, floss, floss.